It is incredibly important to talk about metastatic breast cancer and to have a specific focus on metastatic breast cancer. There has been a lot of attention over the years on breast cancer as a whole, and in particular on early stage breast cancer, but that has left many metastatic breast cancer patients feeling that they're outside of that group. And so they have different needs than patients with early stage breast cancer. And we do need to recognize that they are survivors and that this group is a unique group and needs different types of support than those with early stage disease.
Okay, that's great. What are the misperceptions about metastatic breast cancer? And what can that mean as a diagnosis?
I think there are a lot of misperceptions about metastatic breast cancer. People will often feel that when they get a diagnosis of metastatic breast cancer that this isn't treatable, that there's no hope, when in reality we do have a lot of treatments available. And the goals of treatment are really to extend the length of life, but also to make sure that people have an excellent quality of life. So those two factors need to be balanced when making treatment decisions. And I think the quality of life piece is sometimes underestimated when people are thinking about a new diagnosis of metastatic breast cancer. They're so focused on fighting that cancer, which is incredibly important, but I think that has to be taken in a context of what does that patient's life look like? Are we allowing them to maintain activities with their family and their friends and doing the things that are really important to them as they're receiving their treatment for breast cancer? Because metastatic breast cancer is a journey. This is something that patients are on treatment for the duration of their lifetime. And so it's important to think through what's really valuable for that patient during that time.
That's great. When someone gets a metastatic breast cancer diagnosis, where do they go in Birmingham or in Alabama for help?
There are resources available for patients with metastatic breast cancer. In particular, at the University of Alabama at Birmingham, we have a large breast group. I see predominantly patients with metastatic breast cancer. And then in addition, we have supportive care services such as the supportive and palliative care clinics and nutrition and counseling and other groups that help make that experience better for patients. In addition, there are navigation services both at UAB as well as in the community and support groups that patients can access to meet other patients that have had similar experiences and really hear their stories. I think the most important thing is to be supportive. And in particular for family members, sometimes I recommend that you think about the way that you communicate with people. I had a patient once told me, I'm not sure exactly where she got this from, but a story about drawing circles around a patient. And so if you have something negative to say, make sure that you are dumping out, and making sure that you're not putting that pressure and burden on the patient, but that you're communicating, positive thoughts and words of encouragement. In terms of employers, this is really important that employers are supportive of this population. So patients who are on active treatment, whether they're early stage or metastatic, are probably going to need some flexibility in their employment. They're going to be able to do their jobs, but they may need to rest at times. And you want to, as an employer, be supportive of that so that they can accomplish their treatment. Some people will ask me in particular, should I keep working? And the way I approach that is to ask the patient, is working something that you enjoy and that you find valuable? Because most patients find a lot of purpose in their work, and that's something that if they're physically able to keep working, I encourage them to do, because that's an important part of who we are as a person and how we enjoy our experience, and we don't want to minimize that just because they're undergoing treatment for their breast cancer. Men can absolutely get breast cancer. It is much less common than female breast cancer. In fact, we are doing a study right now at the University of Alabama at Birmingham in conjunction with other sites around the country and frankly around the world, looking at specifically men with breast cancer, what are some of the issues they face in terms of quality of life, how is the biology different than women with breast cancer, and this is another group that needs additional resources and services that we don't talk about as much. This conversation is incredibly important because these patients need support. They need our attention. They need the community to be aware of the issues that they face and how they're different than patients with early stage breast cancer. And we need to be more aware of that as we move forward.
I think having a conversation about metastatic breast cancer is important because everyone is involved. I'm coming from the perspective of an employer, so I think employers also play an important role in supporting that patient with metastatic breast cancer in the workplace. And I think there are so many things that can be done to aid in their total recovery. And work is an important part of life, and people value the work that they do on the job. So I think employers can definitely be supportive. Well, I think definitely friends and family can be there as a support system in that support network, and just really be there for that person. Be available to listen to them, to share ideas, to help them work through specific situations, to offer suggestions, and just really be there to help them problem solve and just kind of work through to find appropriate solutions. In terms of an employer can help and aid in the request for a reasonable accommodation process, and there are things that they can put in place to help that individual that may need things from time to time, depending on where they are with their diagnosis and what type of limitations they might be experiencing. I think there are also benefits that are offered through the employer, and I think it's good to make the employee aware of what those benefits are, because from time to time they may need them, a month down the road, 2 years down the road, but just to kind of get that framework of discussion going. Because they might need short-term disability, they may need long-term disability, they might go out on disability for a while and decide to come back to work as things kind of clear up for them, or not really clear up, but as they get a better hold on what's going on and as they have the ability to work.
Perfect.
So depending on, where someone is with their diagnosis, they might have different needs at different points in times.
I think the conversation about metastatic breast cancer is very important because so much attention is focused on prevention and cure, and there is no cure for metastatic breast cancer. So we need to be talking about how we can support these women as they live their lives, whether they're working or staying at home. There's a lot of misinformation out there about metastatic breast cancer also, and so we hope to do some education about that. For example, stage 4 breast cancer is metastatic breast cancer, but it's not necessarily something that is going to be fatal anytime soon. And I think a lot of people hear that diagnosis and assume that they're talking to someone who's going to die soon, when the reality is there are women who live years with metastatic breast cancer, and they live full and happy lives. There are some accommodations that they might need in the workplace. And their families and friends need to know things they can do to support them. So this conversation is very important.